We saw some surgeons doing surgeries without gloves. They are living in plastic tents, nearly 30,000 inside the hospital and near the hospital. I saw 3 families living on the stairs. From the first night, bombing doesn't stop during night. It was Ramadan, especially from after midnight. They start bombing until early morning. You can't sleep from the bombing, so better to spend this time in theater to do surgeries.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back to another episode of the Ali Brothers podcast. Today we're joined by a very special guest who will address a very interesting and important perspective on the issues going on in Gaza at the moment in particular. As he was in Gaza. So it's important to have those ideas and those experiences expressed to our audience in particular. Personally, just to begin, I'd like to say that a few weeks ago I was watching an interview with Piers Morgan on the Piers Morgan Uncensored YouTube channel, and he had a doctor as well who went to Gaza by the name of Junaid Sultan.
Yeah.
And I watched that interview, and subhanAllah, it's one thing to hear about the politics and to discuss ideas about how we can resolve the issue, but to hear from a person who was actually there, it hits differently. It really hits differently, especially for people of my generation who haven't interacted with conflicts of that nature. It's important for us to understand exactly what's going on a day-to-day basis in the likes of Gaza at the moment. So that was quite an eye-opening experience for me to listen to those stories. And I was saying to myself that these people like Dr. Junaid, these are truly the heroes that we have in our communities. And it's an honor for me to say that, alhamdulillah, I'm joined by one of our own, alhamdulillah, in the community in Ireland, in the Irish community, in Dr. Mohamed Shaallan, who is very gracious to have hosted us in his house today. So, assalamu alaikum, Doctor. Thank you so much for having us.
Welcome.
So, Doctor, just to begin, you're obviously an orthopaedic surgeon based in Ireland. So, if you wouldn't mind just speaking a bit about yourself, perhaps talking about the field that you are specialised in and where you're working at the moment in Ireland, please.
Yeah, thank you for having me and welcome to our house. Actually, I am Mohamed Shaallan. I am working at the moment in one of the major trauma centers in Ireland and as an orthopedic surgeon. And I was graduated from Egypt and I came to Ireland in 2016. Since then I'm working in Ireland. So all of my experience came from Egypt and Saudi, and I went to Germany, and lastly here in Ireland. Yeah.
Inshallah. It's very nice to have you in Ireland with us.
Okay.
So just to get straight into it, what was the motivation for yourself to voluntarily put yourself in a situation which is essentially a war zone at the moment? So what gave you that motivation that you should go and you should help perhaps relieve the situation for some of those who are affected there?
Yeah, I am our Egyptian, and in our culture, if we need someone who needs help, we run to help. And I'm doing volunteer jobs in Africa, different parts in Africa, like Cameroon, Chad, Zanzibar, Burundi, Senegal. So we used to do this from 2010. Every year, maybe we go 3 times, 4 times. It depends on availability of holidays. And because I travel from my annual leaves, so I arrange these times. We go for like 2 weeks, 10 days to do some work there and to get the local people involved with us to get some training. So it is since childhood we brought up like this way to run to help anyone who needs help. And also I did share in 2 wars before, in Gaza 2012 and in Saudi-Yemen conflict in 2016. So this is the reason. And also when Russian-Ukrainian war started, I sent my CV to different organizations to travel to Ukraine to give them a hand. So this is the least thing to do with those people who need help and they are under fire. So
Inshallah, inshallah. Jazakallah khair for your selfless work that you do. I just want to point out that, as you mentioned, that you take time out of your own annual leave to go to these war zones and these areas that are in humanitarian crisis, and we really do appreciate that. And truly, it's only Allah who can reward you for what you're doing. And we ask Allah subhanahu wa ta'ala to bless you, to bless your family immensely with regards to this. Did you ever think twice about, I mean, of course you're doing this quite regularly, so do you ever think twice about what might happen to yourself, or of course your family depend on you? Do you ever think about, does it ever give you pause to think about, should I really be going to these areas? Is it best truly for myself, or what's the thought process behind this?
No, actually, I applied to many organizations in US, in UK, different parts of the world, Doctors Without Border, once the war started, because I am originally Egyptian. So I knew the situation in Gaza, and they are under siege for not 17 years. It is getting tight in the last 17 years, but they are under siege since 70 years. Everything in Gaza, in and out, is counted, and it is known to either Egyptian side or Israeli side, and they don't have like local medical supply. They don't have factories, they don't have companies there for medical supply. I'm orthopaedic, so we are dealing with metal. So I know the situation there, and based on my experience from 2012, I saw many machines like the arthroscope. We use it for keyhole surgery, either in the knee, shoulder, or the ankle, and they need little piece just to make it work, and it wasn't available. So, and when I was there at the time, they asked me, if you come back, please bring this piece with you, so we can do surgery with this machine. And as you know, this arthroscope is it make like big difference for the patient, and big advancement in the whole world to do big surgery through tiny holes. We call it a keyhole surgery. So I know clearly what is the situation there, and it is getting tight during the wartime, because there is no supply, as I mentioned, and the borders closed once the war started, so they don't have any help. And once I applied, really I didn't think for a moment that I can I can reverse back and not to go. Never happened. I applied. I was keen to go from day one. The war started, but unfortunately, border was closed, and the first mission get in Gaza was in February, and I applied to go during this time, but you have to get approval from Egyptian side, Israeli side to go to there, and they give you approval for the time to get in and out, so you are not allowed to stay as long as you can. Or as long as you want. This is not permissible. So I didn't think about this at all. And in our belief as a Muslim, we know if your time comes, so no one can prevent it, you know. And it is a big credit for me or for any Muslim to share in this situation, to give them help. If you are killed, you are a martyr. So this is a big certificate, and any Muslim in his dream to have this situation. Yeah.
Barakallahu feek, barakallahu feek. In terms of your recent trip to Gaza, you went in April this year, I believe.
In March, we traveled on 17th of March. Yeah.
Okay, and you were there for 3 weeks.
For 2.5 weeks.
2.5 weeks.
Yeah.
And what was the process to apply and to travel to Gaza? What was that like?
Yeah, we applied to an organization named Palmed in UK. They have different branches in different European countries, and Rahma worldwide. This is based in US. So I applied to these two organizations, and they sent me email to go in middle of March. So we traveled to Egypt. From here to Egypt, I carried some equipments with me from here, and it was a problem in Cairo airport because this is not permissible, and you have to get approval from Ministry of Health there to get any medical items to Egypt. But I had letters, I spoke to them, and I stayed with them nearly 3 hours to convince them to release these items, because I'm going to place who needs anything to help. As we watch it on the TVs, they don't have local anesthetics, they don't have anesthetics, they don't have sutures, they don't have gloves even. We saw some surgeons doing surgeries without gloves. To protect themselves and to protect the patient also. These gloves to protect the patient, protect you. So at the end they released these items, and we met together because we came from different parts of the world, from US, from UK, from Germany, from Jordan. So from different parts of the world we met together night of 17th of March, and it was Ramadan time. We got iftar later, it was nearly 10 o'clock, and Maghrib time in Egypt it was like 5:30. So yeah, so we wait just to meet together and to have food together. And early morning next day we took bus and we carried all of our items. We arranged some items from Egypt. We bought like the heavy metal, like plate, screws, nails. We got it from Egypt, and we carried them with us in bus and cars. And there was like a retired Egyptian general. He accompanied us just to facilitate our trip across Sinai, because in Sinai there is 5 checkpoints. After you cross the tunnel underneath the Suez Canal, you get in Sinai, you will find big checkpoint for the cars, for trucks, and for the persons. So all the cars or trucks scanned to know what is in these cars, and also for us we scanned, and actually it wasn't much complicated. Just they scanned everything, and we crossed these 5 checkpoints, and we reached Rafah, the Egyptian side, and once we reach there, we start to hear the drones and F-35. F-35, its sound is terrible, very, very loud. We waited like few hours in the Egyptian side until our passport gets stamped there, and our equipments checked again in the Egyptian side. And then 4 buses came from Palestinian side, carried our items, and it is walking distance between the Egyptian side and the Palestinian side. So we reached the Palestinian side just before Maghrib time. They welcomed us warmly, and they didn't allow us to carry anything. They said you have to rest, and we carry everything for you, and everything they bought it in their cars. We moved from Rafah after we got iftar at the Rafah side, Palestinian side. We moved to the European hospital, because European hospital, this is biggest hospital working at that time, but it is not the biggest hospital in Gaza. In Gaza, Shifa is the biggest one, and Nasser, and then the European hospital. But at the time, the Shifa was nearly out of order, because it was nearly completely destroyed by them. And the last attack happened to Shifa when we arrived there. It was the last time, and Shifa now it is out of duty. And when we arrived at the European hospital, from the first night, bombing doesn't stop during night. It was Ramadan, especially from after midnight, they start bombing until early morning. So this is the time you can get some sleep, or because during the day you are fasting and you are doing prayer, then you get some few hours of sleep before suhoor time. So the bombing never stopped, and we felt they are attacking the European hospital. But the local people told us this bombing is near Nasser Hospital. And they were attacking in Nasser Hospital at that time. So we stayed in the nursing faculty there. It is 3 floors. We stayed in the 3rd floor, and it is just mattresses in rooms. And they kept us like 6 or 10 doctors in each room, depends on the size of the room. And they said, sorry, we don't have something suitable. We told them, no, this is very nice. We're not coming here to sleep. We are coming to work. Next day in the morning, we went to the hospital. We explored the hospital, and we got shocked because of the number of families around the hospital. They are living in plastic tents around the hospital, everywhere in the hospital, around the hospital. They told us nearly 30,000 living inside the hospital and near the hospital. And in the hospital corridors, you will find families hanging like bed sheets or anything just to sleep behind it. Everywhere in the hospital, even on the stairs. I saw 3 families living on the stairs. It is like 1 level to go to the theater. So on just the stairs of 1 level, 3 families living there, and one of them has a walker. So this means this patient has orthopedic problem. We went to theater. We explored the theater. Theater is just for theater rooms only, and a small room for eye surgery. And downstairs in the ground floor, there is 1 single theater room for neurosurgery. And we checked the equipment they have. They have instruments, but equipment it is very, very little. So we started to work from what we have. We organized our instruments, implants, and make it ready. And we started work from the first hour, because bombing, people get injured. They brought them by ambulance to the emergency department. Also, I went to the orthopedic department there, which is overcrowded, like a 4-bedded room. You can see nearly 10 or 12 patients, sometimes 2 patients on single bed, and patients on mattresses between beds. Plus the families or their neighbors or their families living in the hospital as well. So they are living with them, they cooking inside these rooms. So this situation is shocking for any surgeon, because you are much concerned about infection. Infection in orthopedic, this is something very major. It can threaten the limb of the patient or threaten the life of the patient. So we thought how to manage in this situation, especially we are doing major surgeries on complicated or complex injuries. No single patient came with closed fracture. All of them, they came with open fracture. Open fracture means broken bone with skin injured. So if you put your finger through the skin wound, you can reach the bone. And this is like a top emergency in orthopedic, because it should be managed very quickly. And usually here we put external fixator for a few days until the wound get clean, and we manage the fracture by definite fixation, either by rod or by plate or by something, you know. But there the patient has only a single chance to be in theater. And because I did work in a war before, I was aware that it is the number of patients is huge number, and you expect new injuries every hour or every day. So we decided to do a definitive fixation for them, to do good washout and then fix the bone, and after the bone we cover the skin, either by skin graft or by flap or something like this, just to cover the bone and the metal. This is the most important. And this the reason Allah make the bone too deep, because it needs protection. And and the fleshy muscle covering the bone, and then the skin. It is like insulator for our body from the external bugs and these things. So you have to protect the bone, protect your metal, and cover them. You can't leave the metal exposed or the bone exposed. So we made plan like this because 250 patients were in extreme fixators waiting surgery. Because when the war started, they started to put X-Fix on everyone as first aid, and then to bring the patient again. But patient has no chance to come again to theater. So I told them we have to work like this. I got some resistance from local people because they are not used to this technique, and also some of the French doctors were with us, and they said no, this is risky. I told them no, I did this before, and we have to apply it like this way, to take from the new injured people plus the old injured people. We have to balance it like this way. Because all newly injured people, you have to manage them acutely. So the patient will get the surgery, will get everything done, just to keep the patient for a few days in the hospital for antibiotic and to watch the wound, and until everything is okay, so patient can go home. But unfortunately in Gaza there is no home. So many patients, I told them, yeah, you are ready to leave the hospital. They said, where to go? Our house is bombed, and even they don't have tent around the hospital to live in. So many patients there in the hospital can be discharged, but there is no chance to send them somewhere. And here in Ireland, if you do like big surgery like this, we send the patient to either for convalescence or for rehabilitation, so that the patient can return as early as possible to his normal life, to normal activity, like these things. But the load on local people, either doctors, nurses, physiotherapy, all are overwhelmed, all are over-exhausted. So we decided to give them some rest, but they refused to. They were with us for in each step, because they want to learn. Because if you are get your training and your work in one place, so you are not exposed to different experiences. So they are keen to learn something from the external doctors coming to them. And as you know, in medicine, you have to attend the conferences, you have to go for short-term fellowship, or to visit certain hospital to get more experience. But unfortunately, this is not available in Gaza. And also, to get experience, you should have equipments and advanced implants to get trained on it, But unfortunately, in Gaza, they don't have this chance, and they have the very basic medical practice there. So we started to do it like this way, and we did work the first day, second day, and usually we check the patient on the second day, how is the wound behaving, how is the patient, like this way. And alhamdulillah, we found everything is going right. And we did work like this, and the local people now texting me to go again to learn this technique and to work like this way, because I got trained also in microsurgery, so I know how to do flaps and skin grafts and these things. So this helped me much to apply this technique there. Yeah.
Right. In terms of the number of patients that you would see, the number of new patients that you would see every day, and the range of injuries that you would witness, and considering that there is a limited number of personnel and also a limited number of amount of equipment, is there a process that you would use in terms of perhaps classifying or triaging the patients, in terms of seeing which ones are more urgent, which ones are less urgent? And what would that process be like?
Yeah, when we went there, we had like two emergency doctors, both of them from US, but they are from Arab roots. I told them we have to make WhatsApp group between us, and also I made WhatsApp group with the local doctors or everyone who's working in orthopedic in this second group. And I told them, once you see patient, take photos and write like 1 line, 2 lines about the injuries and send it, so we can prioritize the patient and see who's more urgent. Because you are working in theater most of the time, you don't have time to go and see patients either in the ward or in emergency department. And some of them, they came to us in theater to say, this patient is more critical. I need you to see this patient. So we saw selected patients, like who needs urgent interference or who needs to go to theater straight away. So we planned it like this. So we make plan and organization, good communication with everyone. Also, we involved the local people, like plastic department there, vascular, cardiothoracic, and also general surgery. We put them in the big group, just for everyone to be aware what's happening. And if we need vascular doctor, just write in the group. He will see the message and he will run where to go. So it was organized very well during this time. And also we once they receive patients and they give us good information, and also we saw the pictures, and sometimes we go down to see the patients. We put patients like in categories: this first, this second, this third, based on the severity of their injury. Some patients we took them straight away to theater, like a patient who has a gunshot in the chest and a broken arm, and some patients also with gunshot in the abdomen. So those patients, they need urgent exploration to check if there is injured vessels, injured viscous, and to deal with it, because if there is internal hemorrhage, you can lose the patient easily. For open fractures or with the skin injury, you can see how much the patient is bleeding, but internally you can't judge, especially in the abdomen and the chest. So patient can lose all of his blood in the abdomen, and you can't notice this. And all of them, they came with low blood pressure because of pain. It is neurogenic shock, and also because of the amount of blood loss. So their blood pressure was low. So once we see them, put the cannula, give them IV fluids, and also make the blood ready to be transfused if we need this. So we organized it like this way, and it went very well, yeah. And we were able to do during these 2.5 weeks, myself only, I did 65 patients, so in total 85 procedures.
Right. Yeah. Wow. SubhanAllah. In terms of your time there, how often would it be the case that you would see patients who would actually pass away because of those injuries that would otherwise, given adequate equipment and good training, that would otherwise be able to be saved? So how often would it be the case that they would actually pass away due to these injuries?
Actually, the ambulance crew, they brought to the hospital the injured people who was still alive. Who was dead on the scene, they leave them. Okay, right. So they brought only the injured people who are still alive. So from my patients, only one passed away on the second day of surgery. I'm not sure why. He has broken thigh bone. We did fixation for it, and he was fine. But on the second day in the evening, they told me patient passed away. But you don't have the tools to investigate what is wrong with the patient, because here, if the patient develops like tachycardia, heart rate going up, and or his breathing is rapid breathing, you can do CT on the pulmonary artery to check if there is clots in the lung, or also you have ultrasound Doppler. You can scan the legs if there is clots or something like this. But there in Gaza, you don't have this facility. In the hospital, only one CT machine working for the whole hospital. Right. So once the patient comes, for the newly injured patients, you order CT. And usually those patients, multi-injured patient, we do the whole body scan, or we call it pan CT. to scan the whole part of the body, because you don't know, sometimes it can be missed injury, so you don't like to miss anything. And also for good planning for the patient, if you know everything about the injuries of the patient, you can make a plan and to involve other teams with you if you need. But based on the X-ray only is not enough everywhere in the world. But in Gaza, unfortunately, they have only one CT scan, so you can't do everything. So you put priority also for scanning. And this is how it works, yeah. But as I told you, the dead people or killed people on the scene, they leave them. They don't bring them to the hospital, yeah.
SubhanAllah. In terms of yourself, and this is a question more focused on yourself as a doctor who is visiting Gaza, how did you manage your emotions? And I'm sure it takes an emotional toll on you to see these patients and the families who are being displaced and who are being injured due to what is going on. How did you manage the situation, and how did it affect you when you came back to Ireland?
Actually, if you are involved in work there, you are distracted from everything. You are focusing on how to save people and how to save their life. This is the first thing. So you didn't think about anything else. This is there. And as I told you, we were there during Ramadan time. So we did work during the day and the night. We got like few hours sleep, and as I explained to you at the beginning, you can't sleep from the bombing, so better to spend this time in theater to do surgeries. So we used to do this, to work from 9 a.m. to 6 p.m. and we go for iftar, for like, we get rest like for 1.5 hours, 2 hours, and then we resume surgery again until 3 or 4 a.m. And we pray Fajr, and then we sleep like for a few hours again and go back to, this is our schedule every day in Gaza. And this was myself. Some of the surgeons, they prefer to sleep during the night. This is their right to get rest, because to be focusing and to be fresh, you have to get enough rest. But if you can't sleep, better to do something good. Otherwise, you will get headache and you will get tired. So to distract yourself by working, it is good. It was good idea. But when I came back to Ireland, it was difficult for me to sleep because of the. It was like a hidden shock, from the types of injuries we saw there. And also, people of Gaza, they are different because they are very patient, and they receive everything with high belief. So we saw them in the TV. They are injured, and they say, "We are staying on our land. We are not leaving like this way." And also the families the same. The expecting patient is dying. So if you come out to them and you say, "Oh, we saved him," oh, they are quite happy because they're expecting he is dead already. So they are totally different people from anyone or any community you can see in the world, because they are under these wars for since childhood, Yeah. And you also, maybe you saw on the TVs how the reaction of the children there. They don't care about the bombing because they are used for it. This is like it became like part of their life, unfortunately, and it is very sad also to see the kids without schools, without teaching there. All of the kids there, all the schools are, majority of them are bombed, and the rest are occupied by families, displaced families. And also the two main universities there in Gaza totally bombed. So Al-Azhar and the Islamic University, both of them are bombed. So, and many of the administration and the staff in the university were killed. So the students also in the colleges are not studying. So the students in medical students, they came to the hospital to work as volunteers and to get some contact with the doctors, to get some knowledge. and to learn some techniques because their life is frozen. And you can't see this anywhere in the world. Like in Ukraine, the war is going on now for several years, but still the life is going on. They go to schools, go to colleges, and life is going on. But in Gaza, the whole life is frozen at the moment, unfortunately. Yeah.
SubhanAllah. It's very powerful to hear that in this perspective, especially for someone like myself, who we have a completely different upbringing in terms of the issues, the quote-unquote issues that we face, and the impatience that we have. I mean, we're on the internet and it takes more than 10 seconds for the Instagram page to refresh. We're like, oh my God, what's going on? I can't I can't deal with this. And then in the other side of the world, you have people whose childhoods are put on hold, or they've been taken away from them.
Yeah.
So just on that point, as you mentioned, that the people of Gaza, they have a very different mindset. They have a very different. They're different people.
Yeah.
Even their children, their elderly, they're truly different people. So, and on that point, many of us Muslims and also non-Muslims, they have accepted Islam by seeing the mental fortitude and the patience and the resilience that they had, the reliance that they had on Allah subhanahu wa ta'ala, that whatever it is, either you stay alive and you can stay and you can help your family, or you pass away and you die as a shaheed, you die as a martyr.
Yeah.
So it's a win-win situation for both of them, as it is described of certain people in the Quran as well. So it's very, very eye-opening. On that regard, as a fatherly figure, what advice would you give young people like myself and other youngsters who are watching this podcast in terms of what we can learn from the elderly and from the children even of Gaza?
Actually, the children in Gaza, they are trying to be more active. Like we saw them every morning when our accommodation, it is like 150 meters from the hospital, so it is very short distance. But the kids, once we are down, they come to hug us and hello, like this way. We told them we are Arabic, we can speak Arabic. So yeah, and they are very educated actually. And the only education they are getting at the moment is the Quran. And we saw many of the kids, they memorized the full Quran there during this time. And also they are using any resources they have to do drawing or painting. And I made like many videos for them. And I created like a YouTube channel just to post updates on it, videos and these things. Because everyone asking me to send this and or tell us about this. I told them, no, I can't do this because we are busy there. So I made this YouTube channel for this purpose, but unfortunately the YouTube, they removed that channel.
Okay.
Yeah, because it was like, I bought some videos for the tents and how the life around the European hospital. They removed everything. And unfortunately I deleted these videos from my phone because I was relying it is on the YouTube. So I lost everything. But I have nice videos for the kids. They are smiling and they told us we love Egypt, we love Ireland, we love the whole world. So they are not as they trying to present them in the media. No, they are very patient, very polite, highly educated, and they, as I mentioned, they are keen to learn. And also I mentioned the local team are over-exhausted, but they are keen to stay to learn something from, because it is a big chance for them to see professors and qualified doctors coming from different parts of the world to help them. So they are keen to learn the techniques from everyone. And I saw them this not only in orthopedics, but in all departments. And also the students, they are keen to learn like this way. So we have to read the history properly for ourselves and for yourself. We have to read the history properly, and we have to know what is broadcasting in the media. Most of it is fake. And you heard maybe about Netanyahu told Biden that 35 kids decapitated on 7th of October, and then the White House they said no, Biden he didn't see this, but this came to the media, so it will be like truth from repeating this word.
Yeah.
So we have to search about the true history of Palestine and how this conflict started. And how the Jewish moved or forced to move from everywhere in the world to Palestine to stay there. I saw some videos for old videos. I think it was 1950 to 51, and like a big ship arrived to part of Palestine, and they sprayed them with DDT. I saw, and the comment was in English, so it is not Arabic from Arabic source. And they went there as refugees, and they got a Palestinian residency permit there. So, but and they started, after they get stronger, they started to push the native people out of their houses. And we see this in the West Bank every day. And if you remember a few years back, they were trying to destroy a house for Palestinian family. And one American girl, she was there, and she stayed in front of these machines coming to destroy the house. And she said, this is for Palestinian family, you can't destroy it. And unfortunately, they killed her. And we saw it live on the TV. So we see how this is happening. They are taking the lands by force. They have the weapon. They have full support from US. And US is the biggest or the major country. Unfortunately, they should protect the international law, but they are, even Biden, he's making decisions and he's not able to apply it on the ground. He, like the deal he presented last week, and he asked Hamas to agree for this deal. Israeli, they rejected this deal. And it was mentioned that it was written by Israeli leaders. So unfortunately, this is the worst. This is the worst occupation in the modern history, and this is the longest as well. How many countries are occupied at the moment? Only Palestine. Yes, Russia invaded Ukraine, but they will come to deal at some stage, and the borders is known. But unfortunately, the Palestine people came from outside Palestine, and they want to take the lands and to control the country. I remember what our grandparents told us the truth. They knew not what was written in the fake books or in the media about how the Palestinians pushed out from their land in Nakba. They promised them just to go out because the war is going on. You will be killed. You will be like this way, and you will come back. But once they get outside Palestine, they never be back. And as far as I remember, 7 million of Palestinians, they pushed out Palestine in 1948, and they never been back. This is the reason why people in Gaza, they are standing on their feet in Gaza. They refuse to go anywhere. Because they know clearly if they leave Gaza, they will never get back. And the main purpose of this war is to occupy Gaza and to evacuate it from their people and push them somewhere. And we heard from even the Egyptian president when he said this with the Germany guy when he visited Egypt. If Israel wanted to send Gazan people somewhere, send them to desert of Nakab. Nakab, it is part of occupied Palestine near Jordan, but it's part of the occupied Palestine. So the main purpose of Israel is to take the whole land, to even the West Bank. And the peace papers was signed by Yasser Arafat and the Israeli. They said we will make two states, Palestinian and the Israeli state. And you can't imagine how much the surface area for Israeli and for Palestine. When they signed this paper, it was like 80% for Israel and 20% only for Gaza. So they took 80% of the land, and they still they wanted to take the 20%. And I watched a video today about Gaza and how rich is Gaza. They have oil in Gaza. They have gas in the Mediterranean Sea in front of Gaza. And this is the reason I think why US they are trying to make a port there, just to put a land to take this oil and this. Also I read report from CNN themselves about what happened in Nusayrat. And they released two hostages from there, and they killed 300 civilian people in Palestinians. Just to release 4, and they killed and they used this port to do this dirty operation. And I read also some of the American army shared in this, plus the intelligence of UK and US. They supplied them with the information. So imagine how the power, major power, Palestinians in Gaza, they are facing. Nearly the whole world. They are facing the whole world, not only Israel. If it is only Israel, I think Israel, they can't continue in this war for a week if they by themselves. And Netanyahu, he said by himself, if America, they don't supply us with weapons, after 1 week we will fight with sticks. And this is, and you are speaking about an army. They are saying it is the strongest army in the Middle East. And if you look to people in Gaza, they are fighting now for nearly 9 months with what they have and what they make by their hands. And it is very primitive weapon. It is not advanced, not smart weapons. So it is hard. So we have, and the major benefit of 7th of October, it brought the Palestinian case to the surface. If you ask anyone about Palestine or about Gaza before 7th of October, no one knows about it. No one cared about it. It was dead case actually. So 7th of October, it brought it to the surface. And now it is in the heart of not only Arab or Muslim people, it is in the heart of European, American. And you see, you saw students in the dead camping in many universities. And some of them arrested, some of them they ended their career and just because they are protesting against Israel and anti-Semitism and anti-Semitism. It should protect us as Arab because we are Semitic. So why it is just protecting Israel only? So, and you heard about what's happening against the ICC judges. They are threatening them if they take an action against Israeli leaders, they will do something against them. So it is quite hard, and you see how is the international law is not respected by the one who make this law, unfortunately. So it was clear to everyone now in the world that how is the Palestinian was taken in not 1948. 1948 it was declaration of Israel. They announced that there is Israel, but this was going on since Balfour Promise in 1917. So they were working since this time and to declare that Israel is existing in 1948. And unfortunately, it existed on the blood of innocent people, unfortunately. During our stay in Gaza, we didn't see anyone carrying any weapon at all. And we didn't treat anyone from Hamas or any fighters from Palestinian side at all. All are innocent people, and they are living in their houses, and they get bombed or killed in their houses. Imagine the drones, it can fire and it can kill some people. Because someone sitting on his office in Israeli side, and he just playing this drone. And if once he decide to kill this man, just press the button and it will fire this man. And I saw multiple injuries from these drones. So it is actually, it is very shocking for the behavior of the international community. And they made decision in the like Security Council twice at the moment. And is it applied? No. So fortunately, the 7th of October, it brought everything to the surface.
Yeah.
And the Palestinian case, I was in Germany before 3 weeks in a conference in Hamburg, and it was near to Hamburg University, and I saw some tents or camping in a park just in front of the university. When I did ask, they said, "Oh, we have the Palestinian flag. It is big, but it was hiding behind the trees." And they said, "We are supporting Palestine," and they are Germany people. Majority of them are originally from Germany, and some of them from Arab Palestine, like this way. And when they knew that I was in Gaza, they invited me to give them a talk about this. And it was big number of people attended, and they asked me. It was planned to be 45 minutes and extended to 2 hours. And they sent me email last week to invite me again, and it will be end of this month. It will be on 29th of June, to go to Hamburg University to also to give them a talk about what's happening in Gaza. So fortunately, what's happening, and also everything is recorded in the media, like in the news channels. But this is part of it, not everything. If you see what's going on the ground, it is shocking. Not like this is like 20 or 25% of what's happening there, because it is just single camera. So you record what's around you, what's happening in the region bombed. Actually, you can't record it. And you presented us as a heroes at the beginning, but the heroes, the real heroes, the ambulance crew. Because once they hear bombing somewhere, they run. And they try to save people, to take them out of the scene while the bombing is going on. And I hear many of them killed. And I treated some of the injured nurses from the ambulance crew there. So those people, actually, they are the real crew. Also, if we get multiple injured patient here, usually we send the consultation to psychologists to come to the patient to give them some psychological support. But in Gaza, this is not available. But alhamdulillah, they are getting this psychological support from Quran and from their belief in Allah subhanahu wa ta'ala. Allah subhanahu wa ta'ala will give them the victory at the end for sure, inshallah.
Inshallah. You've been very generous with your time, Doctor. If I can bring this podcast closer to a close, just to ask about what the situation is right now in the European hospital in Gaza. Do you know what the situation is at the moment?
Yeah, I'm in contact with the local people there, the head of the department in orthopaedic, and also the nurses who's responsible for the medical supply. They are short in everything at the moment. I was planning to go on 13th today to there, but unfortunately this should happen through Jordan. And if you go through Jordan, you will come across the occupied part of Palestine. It is controlled by Israel. We got messages from the first team who entered before two weeks that they are checking everything. They allow you to go by your personal items only. If you carry gloves or sutures or any medical equipment, they return it back. If you carry new clothes, they return it back, even for yourself. If it is packed as new, they return it back. They return it also. I got a long message on the WhatsApp if you are carrying like clothes for kids or for women, they return it back. They allow you to go buy what they are 100% sure it is yours. So it is hard. So the head of the department told me, if you come now, you will not do much because we are out of stock. We don't have much medical supply at the moment. So better to wait until we get medical supply and come again. Hopefully I will go back first week of July. This is my plan. But unfortunately, they don't have like external support at the moment. Only they have one orthopedic doctor from Jordan, because in Jordan easy to travel through. They have some deal. So only one Jordanian orthopedic doctor working with them at the moment. So the main burden now is on the local people. And as I mentioned, they are exhausted. They are working since October without salary. Even the majority of them are volunteers. They came from the damaged hospital, like Shifa, Nasser. I met them, and they are living in tents around the hospital, and they are working. Some of them, they are working far, but they also keen to come. They told us many of the healthcare workers are not able to come to the hospital because they don't have the money of transportation to come to the hospital. And also it is unsafe sometimes to move from one part to another part in Gaza. The whole Gaza is unsafe actually, but they are keen to come, and they don't care about what's happening, but they keen to come. So they are not getting salary, and the volunteers also, they are not getting any money. So it is quite hard, but still they are working, and they are keen to help their people and to treat them because their family. And also like this is our mission as a doctors, to treat any injured or anyone who needs medical help. You have to do it for him regardless of the risks or the benefits or these things at all. And this is what's happening in Gaza at the moment. Yeah,
especially at the moment, they don't have the support. They don't have the kind of recognition that perhaps there is on the other side, the Israeli side. So absolutely, to support that side, it's very, very important from the perspective of humanitarian aid, but also shedding light on the actual situation there, the political situation and the situation on the ground. Jazakallah khair, Doctor, for your time. You've been very generous. Jazakallah khair.
But last word, to the people who are watching you, just keep supporting them, because they need a lot of support, and we have to speak about them with people. And also for us, we speak about our kids, what's going on. They can't watch the TV because it's shocking sometimes. So, but we explain to them what's going on, and they are asking, they are keen to know. And by this way, this is the message we can deliver to the people around us and to the next generation until the whole Palestine get free, inshallah.
Inshallah. And especially now, since October 7th, as you've mentioned, this is a time where people have really seen the situation up front, and they've seen the double standards and the hypocrisy on the sides that are showing it. So we ask Allah subhanahu wa ta'ala to grant victory and support and success to our brothers and sisters in Gaza and in Palestine. And we ask Allah subhanahu wa ta'ala to allow us to be tools, to be a means of easing the situation for our brothers and sisters, inshallah. Jazakumullah khairan for joining us today, and we'll see you again for another podcast. Assalamu alaikum wa rahmatullahi wa barakatuh.